Hello, welcome back to Pharma Training Solutions. So today we shall be discussing the hemoptysis and the coagulation disorders. Of course, this is again a short presentation. Of course, hemoptysis is a process of continuous formation of blood cells, and of course we know it occurs in the bone marrows. Now, of course, it requires adequate supply of minerals. The common one is iron, and of course all these others, and some vitamins are also required: folic acid and vitamin B12, pyroxidine, and riboflavin. Of course, in deficiency of iron, we get anemia, and of course deficiency of vitamin B12, we get the megaloblastic anemia. Now, of course, erythropoiesis, this one is used in this is a process of formation of red blood cell, and so which we shall study mostly. Now, erythropoietin, which is synthesized from the kidney, is responsible. It stimulates erythropoiesis via division and differentiation of the progenitor cells in the bone marrow. Now, these progenitor cells are those cells which have been committed to red blood cell. Remember, to formation of red blood cell, I'm sure you are aware of that. Progenitor cells, they are those ones which commit to form white blood cell, red blood cell, platelets, and all these other ones. Now, for erythropoietin, it stimulates those progenitor cells in the bone marrow which have committed themselves to formation of red blood cell. Now, we have recombinant erythropoietin, poietin alpha and diapoietin alpha. Of course, these are used in conjunction with iron in renal failure patient, those ones who have anemia. Now, of course, we know iron is very important in the component of hemoglobin, which is required in oxygen transportation. And of course, when it is deficient, we have iron deficiency. Anemia can be given by oral therapy. In the pharmacy, we have these ones: ferrous sulfate, there are these tablets, ferrous gluconate, and also the ferrous fumarate. And it's also available in the combination with ferrous with folic acid. Ferrous sulfate for FeFo. It's called FeFo, what you call FeFo. Ferrous sulfate and folic acid required in, of course, you know, folic acid is required in the DNA synthesis. And we also have parenteral iron, iron dextran, and sodium ferric. Now, again, we have the cyanocobalamine, because this is a vitamin B12 injection or a tablet. It is used in megaloblastic anemia. Remember, we are in those disorders for anemia. Now, of course, briefly, now let us look at the blood coagulation. Now, of course, we know that blood coagulation, this is the process of formation of stopping clot, or formation of formation of clot to stop bleeding. Now, I will not explain the pathways, but I'll just say that there is extrinsic and intrinsic pathway, and again, all of them, they meet at the common pathway. I hope you know how that pathway is. Ensure you know that pathway. Read further. Now, of course, the clotting factors are always activated. We have inactivated and activated. Now, of course, the platelets begin to adhere to the collagen through the action of receptors. Activated platelets then release the ADP, that is adenosine diphosphate. Now, of course, we know that again we having thromboxane. Thromboxane also is required. It activates. This is a prostaglandin. It also attracts those other cells for resulting in formation of that clot initially. And of course, this is inhibited by it is produced by cyclooxygenase. Vitamin K is very important in its synthesis of functional clotting factors in the liver, such as factor 2, 7, 9, and 10. And of course, calcium plays also a key role. That's why in those tubes which collect blood in the laboratories, they contain editor. Of course, we know editor chelates all the calcium from blood, and it inhibits the clotting process. Now let me talk about the coagulation disorders. Remember, I've said ensure that you know the pathways, intrinsic, extrinsic, and how they link up. It's very important to know. We have von Willebrand disease. This is a defect in a primary hemostasis plug formation. This one here, this is the primary hemostat formation. We also have hemophilia. Of course, we know hemophilia is it is inherited on chromosome X. Now, of course, hemophilia deficiency of factor 8 causes hemophilia A, and factor 9 causes hemophilia B, also referred to as the Christmas disease. Now, of course, we know that with hemophilia, any scratch on the skin can lead to uncontrolled bleeding. We also have other disorders which are formed when blood coagulates within the vessels, when it's not required. Formation of blood clot within blood vessels. It can be superficial. Superficial. You can see that one on the vein, usually. Superficial. However, we can also have deep vein thrombosis, so this is dangerous. Deep vein and pulmonary embolism. This can cause death. Can also have anterior thromboembolism or thrombosis. Now, which agents are used in thromboembolism or to prevent coagulation? The anticoagulants. We're having the thrombin inhibitors. Of course, in the common pathway, we know that activated factor 10 cleaves prothrombin to thrombin, which in turn forms fibrin from fibrinogen. I'm sure you're aware of that from the intrinsic, from the common pathway. And of course, this is of course the basis for coagulation. Now, which are those? We have direct and indirect thrombin inhibitors. Now, the direct thrombin inhibitors, they act on active sites of the thrombin to inhibit this effect. Are you seeing? They inhibit the fibrin formation by acting on thrombin. This one. Now, examples, we have the parenteral, lepirudin, and oral diapigatran. And these ones are used to reduce risk of stroke and systemic embolism, and also to prevent venous thromboembolism. Of course, you know the side effects when we remember we are inhibiting what clotting. So it means that in case of anything, we can cause increased bleeding. Now, we also have indirect thrombin inhibitors. This one, they do not act directly on the thrombin, but they inactivate factor 10 activated. Of course, as I have said, it is required in the synthesis of thrombin. So they inhibit it directly. So they inactivate factor 10, activate factor 10, which is required in the synthesis of thrombin. Now, examples, we have heparin. Of course, in the pharmacy, we have the low molecular weight heparin. I'm sure you are aware of this one. The enoxaparin, dalteparin, and tinzaparin. Of course, the common one we know of is enoxaparin. Or we also have unfractionated heparin. Now, this, of course, they are used in prophylaxis and treatment of venous thrombosis. Of course, as the initial treatment. Later on, we use warfarin. Now, the antagonist of heparin is very important to know is protamine. I hope you know this mechanism of how protamine reverses the effects of heparin. Should be aware of this mechanism. I may explain it briefly in our presentation for pharmacodynamics. Let us look at now the factor 10, activated factor 10 inhibitors. We're having rivaroxaban, this one, they inhibit factor 10 in the final common pathway of the clotting. Used in acute deep vein thrombosis or pulmonary embolism, and also again to prevent venous thromboembolism. I'm sure you are aware of this, or in your notes you have them or you can refer to standard books, or again you can go online and read. You have these apps on your phone. You can type in just rivaroxaban and then you read more. It's very important to read. We also have the coumarin antagonists. These are now the oral drugs. We have warfarin, the kumoro. These are vitamin K antagonists. Of course, now because we know that vitamin K is required in synthesis of functional protein factors 7, 9, and 10, and of course the thrombin. So again, these are used in deep vein thrombosis after initial course of heparin. Now the effects of warfarin can be reversed with vitamin K1 or the phytonadione injection, or even you can give for fresh frozen plasma. I'm sure you're aware of this. I'm sure at least you know the reverse, what can reverse the effects of both heparin and warfarin. Now let us look at the antifibrinolytic agents. Antifibrinolytic agents. Of course, you know that one of them is tranexamic acid. Of course, you know tranexamic is used to control excess bleeding. This is an antifibrinolytic agent that competitively inhibits the activation of plasmin. Now, plasmin is required in degrading of the clotting factors. Remember, we have uncontrolled bleeding. Now, so the only thing how we can prevent it is by preventing the clotting. The clotting factor should stay longer in saturation, and hence they cause clotting. So that's why tranexamic acid is used in heavy menstrual bleeding, because it can act as antifibrinolytic agent to inhibit plasmin, this enzyme which degrades the clotting factors. And of course, we know that when you have clotting factors in the blood can start to clot. The other one is aminocaproic acid. I'm sure you're aware of this. Let me see. Let us look at now the other antiplatelet therapy which can be used. Of course, we are aware of acetylsalicylic acid. It inhibits COX-1, which is required in case of thromboxane, and inducer of platelet aggregation. It is given the daily dose of 75 milligrams. Clopidogrel, it reduces platelet aggregation by inhibiting ADP synthesis pathway. Let me first take you back here, ADP, because we know that platelets, one of them, activated platelets can release this ADP. Of course, that ADP will will attract other platelets. So that's why we use clopidogrel. The others which are used, we have dipyramidol. Now also have the platelet glycoprotein. They inhibit the enzymes on platelets. So the receptors on platelets. These are the blockers of 1B and 1,3A receptor blockers, apiximabine and epifibatide. These ones are also used. Remember, this has been a short presentation on blood, on hemoptysis and coagulation disorders. Always refer to your standard guide, standard books, your notes, or you can contact us for more information. I always remain Wilson from M-Pharma Training Solution. Subscribe to the channel in case you haven't subscribed. Leave a comment on how we can improve for it in other presentation. Get back to us. Send us an email. WhatsApp shall always reply. Thank you very much.